Good evening, delegates. Thank you for joining Shield Connect. Today we have a special doctor from Nagpur, Dr. Shahnaz Hussain, and ma'am is going to speak about recurrent and chronic vaginal infections and what to do about it. So before we start with the session, let me give a brief introduction of our speaker for the day. Let me share my screen. So Dr. Shahnaz Hussain, ma'am has done MBBS, DGO from MGIMS Sevagram. Ma'am is currently director of Zaveri Nursing Home, and ma'am is doing private practice since 25 years. Ma'am is also a life member of NOGS, FOXY, AMF, and IMA. So I welcome ma'am on our platform for today's webinar. And ma'am, I hand over the session to you, ma'am. Thank you for joining Shield Connect.
Thank you for the nice introduction. Good evening and greetings from Nagpur to everyone. It's an honor and privilege for me to be a part of this wonderful learning platform. And I thank Field Healthcare for giving me this opportunity. My topic for today is recurrent and chronic vaginal infections, what to do. I hope I can throw some light on this important and relevant topic nowadays, which every gynecologist has to face almost daily. Also, in the era of increasing cases of infertility and BOH, we need to understand and treat vaginal infections effectively so as to prevent complications later on. My slide is not moving. Hello? Hello?
Yes. Yes, ma'am, please tell me.
Can you hear me? My slide is not moving.
Ma'am, you can reshare the screen once again.
Just stop it and you can reshare, ma'am. Might be some.
So it will start working again.
New share I'll do.
You have to stop the sharing and again you have to share the screen. Yes. Now again you have to share the screen.
Is it okay?
Yes. Now the slide mode.
It's okay?
Ma'am, full screen view.
Yeah,
Yes, it's going.
Should I continue? Hello?
No, ma'am, it's still stuck 1 minute.
Yeah, see? My screen is moving now.
Bharatji?
It is not moving, ma'am, here actually.
My screens are moving.
Okay. Just close it, ma'am, once. Just close it.
Okay.
Yeah, just please close it.
See, it's moving now.
Yeah, so for the others, it is not actually, I'm not able to see that moving slides.
Yes, ma'am. Even here I
just close it, please close it. Just that PPT, just please close it and you just reopen the slide.
My slides are moving. You are not able to see?
No, ma'am. Only first slide we can see.
See, once again. See, now it's moving. Has it moved?
No, ma'am. It is still stuck there. फिर से एक बार reshare कर दीजिए. Stop करके. And yeah, now it is moving. We can see the second slide.
So I'm there with C now. No.
Yeah. Now we can also see the third one, ecosystem.
So I'm just moving separately from the beginning slide, so I'll put it. Okay.
Yes.
Moving? No.
Yes, we can see your screen now clearly. The arrow is moving.
Yeah. See, you can move. You can see. Hello.
Yeah,
no, ma'am. When you start with from beginning, it gets stuck.
They probably start coming from the beginning.
Yeah. One. Okay.
गया move हुआ?
नहीं, अभी अटक गया है.
What to do?
Madam, you please close that sharing once again and reshare once again, madam. Then it will be in a sharing mode, slides mode.
Doing the same thing. No? Okay, stop sharing.
Yeah, please restart once again, madam.
Yes, yes, click on that.
Yeah, now it's moving.
One moment, ma'am.
Is it seen?
No, ma'am.
Nice.
ये desktop पे save है ना मैम PPT?
Yeah.
भरत
Yes.
जी,
You move my screen then. Why? I don't know why it's not moving. I can shift the
Yes,
slide.
there may be some technical issue from Zoom. 1 minute, ma'am. भरत जी. Yeah, now we can see the
Visible now.
Visible now. It's maximized here. Now it's seen.
yes.
Yeah,
It's
it is
okay
now.
if
Yes,
you
ma'am.
want
Yes, ma'am. Yes,
to
ma'am.
work on
Then
this
वो
slide.
slideshow में जाके it gets stuck up.
Yeah, so अगर आप ये मोड पे भी चलाओगे तो चलेगा मैम.
देखो आप. See, moving.
हाँ, फिर स्टक हो जाता है.
I know my screen is moving. How come I don't know what's
Maybe
happening.
there must be some Zoom issue.
So I'll move one slide and then.
Yeah, it's fine.
Okay.
चलेगा
This
ये.
one is okay. See,
Yes,
the next
yes.
one is
Yes,
okay.
yes.
I'll do this way then.
Yes,
Your
yes,
screens
yes.
are visible.
Yes, ma'am.
Full screen is there for you all.
Yes, you can continue, ma'am.
Okay.
Yes, ma'am.
Sorry for the interruption. And my topic for today is recurrent and chronic vaginal infections. What to do? Every female has a specific. Every female harbors a specific number and specific type of lactobacilli in her vagina. Many different bacteria usually inhabit the vagina. Example, lactobacilli, which excrete hydrogen peroxide, creating an acidic environment, which is a natural disinfectant to maintain the normal balance of organisms in the vagina that is hostile to disease bacteria. Any condition that changes the vaginal acidity or disturbs the normal bacteria in the vagina may predispose to an infection. There is a delicate balance between the two major microorganisms normally found in the vagina of women during their reproductive years. These microorganisms are usually Candida albicans, that is a fungus, and Lactobacillus, that is a bacteria. Let us see the ecosystem in vagina. Vagina is lined by stratified squamous epithelium. Because of estrogen in women, it promotes glycogen synthesis in the vaginal epithelial cells. This glycogen is then used by lactobacilli, that is the good bacilli, also called doddeline bacilli, which are normally present in vagina. It releases lactic acid that makes the vaginal pH acidic. It is between 3.5 to 4.5. When this pH becomes alkaline, vagina is prone to infection. Normal phases in women where pH is alkaline, it is in the prepubertal girls because estrogen is not there, during menses, after menopause, and therefore women are more prone to infection in these phases of life. Now, vaginal infection is basically the overgrowth of bacteria which is normally present in vagina, whereas vaginitis is just the inflammation of the vagina. Itis means inflammation. Different types of vaginal infections that we are going to discuss are the bacterial vaginosis, trichomoniasis vaginosis, and candidiasis. we see at the risk factors, the repeated alkalization of the vagina is the most important and the common risk factor. Poor personal hygiene, obesity, using too much of alkaline soap, uncontrolled diabetes, wearing too tight clothes, use of feminine deodorants, douches, and scented sanitary products, excessive and use of antibiotics and hormonal contraceptives, stress, multiple sexual partners without protection, pregnancy, recent childbirth, or menopause, inadequate sleep, and poor nutrition. These are the risk factors for vaginal infections. Let us come to the bacterial vaginosis. It is the most common type of infection. It is not an infection basically, nor an STD. It is the name of a condition in women where the normal balance of bacteria in the vagina is disrupted and it is replaced by an overgrowth of certain bacteria. It is sometimes accompanied by discharge, odor, pain, itching, and burning. It is a polymicrobial clinical syndrome resulting from replacement of the normal H2O2 producing lactobacilli in the vagina with high concentrations of anaerobic bacteria like Gardnerella vaginalis, Mycoplasma hominis, Uriplasma uroliticum, and Mobilingus species. Trichomonas vaginalis. It is caused by a protozoan, Trichomonas vaginalis. It is a STD and it is characterized by greenish, thin, frothy vaginal discharge. There's intense itching is present and it is usually associated with dysuria, that is pain during urination. On PS examination, it shows redness of the labia and vagina. And small petechial hemorrhages are seen on cervix and vagina, that is the typical strawberry sign. However, in 50% of women infected do not have any symptoms. Vulvovaginal candidiasis is usually caused by Candida albicans, which is a fungus, but occasionally is caused by other Candida species or yeast. An estimated 75% of women will have at least one episode of vulvovaginal candidiasis, and 40 to 45% will have two or more episodes. Typical symptoms are intense pruritus, vaginal soreness, vaginal excoriation, dyspareunia, and external dysuria. It is called splash dysuria because there is intense burning because of vaginal excoriation. And the typical abnormal vaginal discharge, like white, curd-like, cotton cheesy vaginal discharge, is present. And the pH is acidic. Candida grows in acidic pH. Let us come to the diagnostic considerations of bacterial vaginosis. Bacterial vaginosis can be diagnosed by the use of clinical criteria that we call as Amsel's criteria or Gram staining. Clinical criteria require three of the following symptoms or signs. First is homogeneous thin white discharge that smoothly coats the vaginal walls. Second, presence of clue cells. That is, these are the epithelial cells with fuzzy borders, seen on microscopic examination. pH of the vagina should be more than 4.5 and a distressing fishy odor of vaginal discharge before or after addition of 10% pH. That is Whiff test or the amine test. However, the gold standard is the ground staining and the Nugent score is used. That is, we count positive and the negative rods, and gram negative rods are more in bacterial vaginosis. These are the typical clue cells, epithelial cells with fuzzy borders that clinches the diagnosis of bacterial vaginosis. Trichomonias vaginitis, diagnostic considerations. The investigation of choice is usually the microscopy of the vaginal secretions. However, the gold standard is the culture. It is most sensitive and specific. DNA probe test can also be done if it is available. Vulvovaginal candidiasis. Diagnostic considerations in uncomplicated. It is based upon the clinical features that we have discussed, demonstration of candidial mycelia in wet preparation by adding 10% QoS, or gram staining, that is the gold standard, in which the yeast or the pseudohyphae are identified. Culture or other tests yields a positive result for a yeast species, and the normal pH is acidic, that is less than 4.5 in cases of Candida. These are the hyphae and the pseudohyphae seen on ground staining. Let us come to the recurrent bacterial vaginosis. Recurrent bacterial vaginosis is defined as 3 or more episodes in 12 months. The repetition rates as high as 30 to 50% within 3 months is designated as recurrent bacterial vaginosis. Other factors that have been associated with recurrence include repeated douching, frequent sexual intercourse without taking any precautions, failure to re-establish a lactobacillus predominant vaginal flora. It has also been suggested that formation of a vaginal biofilm in bacterial vaginosis could be one of the factors in recurrent infection. It implies that the infection is difficult to treat and patient will probably experience relapses. Recurrent trichomoniasis is the most common non-viral STD in women worldwide. It is associated with reproductive morbidity and increased risk of HIV acquisition and transmission. Nucleic acid amplification testing, that is NAT, is recommended for diagnosis of trichomoniasis. It is based upon the principle of DNA PCR testing. What is recurrent vulvovaginal candidiasis? It is defined as at least 3 symptomatic episodes in 12 months. Risk of recurrence is increased in patients who frequently take antibiotics, are chronic users of corticosteroids, who are immunocompromised like HIV patients, transplant patients, who have uncontrolled or very poorly controlled diabetes, or who are azole resistant or non-candida albicans vulvovaginal candidiasis. So to see the complications, if the infection is not treated on time, it can ascend upwards and it causes pelvic inflammatory disease, HIV infection, persistent discomfort. Patient complains of chronic pelvic pain. If infection is more, then patient may complain of fever also. Infertility. Now, complications during pregnancy are risk of miscarriage, preterm birth, preterm rupture of membranes, low birth weight in the newborn, and post-abortion endometritis. Let us see the treatment part. The recommended treatment for trichomoniasis vaginitis is the drug of choice is metronidazole. It is given 2 gram orally in a single dose, or tinidazole 2 gram orally in a single dose. The cure rate by using oral metronidazole is 90 to 95%. However, in resistant cases, oral metronidazole may be repeated after 4 to 6 weeks. Alternative treatment is it can be given 500 milligrams twice daily for 7 days. Follow-up is unnecessary for men and women who become asymptomatic after treatment or who are initially asymptomatic. However, management of sex partners is very important and they should be treated. Patients should be instructed to avoid sex for at least 7 days until they and their sex partners are cured completely. Special considerations if you see in pregnancy. Vaginal trichomonas have been associated with adverse pregnancy outcomes, particularly premature rupture of membranes, preterm delivery, and low birth weight in the newborn. Women may be treated with 2 grams of metronidazole in a single dose. Metronidazole is a category B drug. Therefore, it should be used cautiously. It should not be given orally in the first trimester. However, in the second trimester onwards, patient can take oral metronidazole. In the first trimester, vaginal pessaries can be given. If in cases of recurrent trichomoniasis, if persistent infection is documented despite the previous therapy without evidence of reinfection, there are case studies and reports documenting success using high dose of tinidazole, that is tinidazole 500 milligrams 4 times a day for 1 week, or oral tinidazole combined with vaginal tinidazole 500 milligrams twice daily for 14 days. Let us come to the treatment part of uncomplicated vulvovaginal candidiasis. In such cases, a short course topical formulations, either pessaries or creams in single dose or 3 days regimen, effectively treats uncomplicated vulvovaginal candidiasis. The topically applied azole drugs are more effective than nystatin. Treatment with azoles results in relief of symptoms and as well as negative cultures in 80 to 90% of patients who complete the therapy. So the intravaginal agents used are clotrimazole, metronidazole, fluconazole, ketoconazole, and oral agent is fluconazole, that is 150 milligram oral tablet, 1 tablet in a single dose. However, fluconazole is contraindicated in pregnant patients. Recommended treatment for recurrent vulvovaginal candidiasis include fluconazole 150 milligram orally every 72 hours for 3 doses, followed by 150 milligram weekly for 6 months, or in patients who prefer vaginal route for maintenance therapy, miconazole 1200 milligram vaginally weekly for 6 months can be given. Or alternative is ketoconazole 200 milligram orally twice daily for 3 days, followed by ketoconazole 100 to 200 milligram daily for 6 months. All women who have symptomatic disease, bacterial vaginosis, require treatment. Recommended treatment for non-pregnant women is metronidazole 500 milligrams orally twice daily for 7 days, or metronidazole intravaginal gel 5 grams once daily for 5 days. or alternative could be clindamycin cream intravaginally at bedtime for 7 days. However, oral is contraindicated in pregnancy, should be avoided in the first trimester specifically. Can be given second trimester onwards in pregnant patients. Followed with bacterial vaginosis is unnecessary if symptoms resolve, because recurrence of bacterial vaginosis is not unusual. Women should be advised to return for additional therapy if symptoms recur, and the management of sex partners is not recommended because the results of clinical trials indicate that a woman's response to therapy and the likelihood of relapse or recurrence are not affected by treatment of her sex partner. All pregnant women who have symptomatic disease require treatment. Metronidazole 250 mg TDS for 7 days or clindamycin 300 mg orally twice a day for 7 days. Again, it should be given second trimester onwards only. Follow-up of pregnant patients is very important. Treatment of bacterial vaginosis in asymptomatic pregnant women who are at high risk for preterm delivery might prevent adverse pregnancy complications and outcomes. Therefore, a follow-up evaluation after 1 month of completion of treatment should be considered to evaluate whether the treatment was effective or not. The current treatment options for bacterial vaginosis, antibiotics, antifungals remain mainstay of therapy, and the recurrence rate is high and associated with side effects. So the solution, we have to find out the gut and the female reproductive tract are in constant communication with each other via microbial metabolites, our immune system, and our circulatory system. When gut dysbiosis exists, vaginal dysbiosis is always present. They say that all diseases begin in the gut. Imbalances in the gut microbiota composition can lead to several diseases and conditions like reproductive and infertility dysbiosis, bacterial vaginosis, endometriosis, polycystic ovaries, intrauterine dysbiosis, certain cancers, and infertility. Looking into the future, probiotics containing lactobacillus can be used over a long period. It is an alternative to antibiotics, particularly within the context of high infection recurrence rates and possibility of harnessing specific bacterial strains in order to prime the vaginal microbiota in the pre and periconceptional periods. What are probiotics? According to WHO, probiotics are live organisms which, when administered in adequate amounts, confer a health benefit on the host. Main types of microbes used are lactic acid bacteria and bifidobacteria. History of probiotics is very interesting. The concept of probiotics was first introduced in the 20th century by Nobel Prize winner Elie Metchnikoff. He suggested that long and healthy life of Bulgarian peasants resulted from their consumption of fermented milk products. So he introduced in his diet sour milk fermented with bacteria which he called Bulgarian bacillus. Later it is called as the lactobacillus, and he found out that his health was benefited. So he proposed that consumption of fermenting food products positively influenced the microflora of the colon, decreasing toxic microbial activity, decreasing intestinal pH, and that suppresses the growth of proteolytic bacteria. The mechanism of action is the proposed direct and indirect antipathogenic mechanisms of lactobacilli include production of lactic acid and bacteriocins that directly kill or inhibit bacterial and viral pathogens, formation of microcolonies that adhere to the epithelial cell receptors and form a physical barrier against pathogen adhesion, stimulation of host defense mechanisms against pathogens. What are prebiotics? Prebiotics are compounds in food that induce the growth or activity of beneficial microorganisms. Prebiotics and probiotics are together called symbiotics. These substances come from types of carbohydrates, mostly the fiber that humans cannot digest. The beneficial bacteria in your gut eat this fiber called gut microbiota. So the rationale of using lactobacilli as a probiotic to maintain the healthy lactobacilli dominated vaginal flora, prevent preterm labor, provide good quality of life of women, in women prone to urogenital infections or during infections, in healthy women as a prophylaxis to maintain normal flora. Lactobacilli probiotics can be used over a long period without adverse effects, unlike antibiotics. If we see probiotics versus antibiotics, antibiotics causes damage to the commensal microflora, can increase the occurrence of resistant bacteria, and usually have adverse side effects. Whereas probiotics can be used in adjunction to antibiotics to restore the commensal flora. So the ideal treatment should be to provide Indian genome-specific strains, vaginal-specific strains, and use maximum of 10 billion colony-forming units. There are multiple benefits of probiotics for the woman. It boosts immunity, enhances skin health, balances vaginal pH, reduces inflammation and acne outbreaks, lowers the risk of yeast infection, candida infection, increases nutrient absorption, and improves the gut health. If we see the use of probiotics for infertility, looking beyond these more general applications of probiotics, specific research into probiotics for fertility has been looked upon. In cases of infections and infertility, presence of pathogen that is bad bacteria in the placenta and amniotic fluid, inflammation and infertility. Taking well-researched probiotics to support both gut health and intimate health, eliminate several barriers to fertility, and increase our chances of conceiving and maintaining a healthy pregnancy. Many studies have shown that abnormal vaginal microbiota may be associated with poor reproductive outcomes. Why strains of native origin? It is now widely accepted that native strains will have better efficacy on the local populations. So, identification of cultured vaginal lactobacilli using DNA PCR testing is done, and the right lactobacilli is selected. The species usually used in treatment are Lactobacillus cristatus, Jensenii, gazeri, and Inners. Probiotics and fertility. Probiotics prevent sperm lipid peroxidation, that is, oxidative damage to the sperm. Pre-treatment with probiotics prevents the effect on both sperm motility and viability. Probiotic protects human spermatozoa from radical oxygen species in the presence of vaginal disorders and improves the fertilization potential of the female host. So, treating bacterial vaginosis increasing pregnancy rate. Actually, it doubles the pregnancy rate when the treatment is completed. A high lactobacillus load can enhance the vitality of gametes in the male genital tract and stabilize the microenvironment of the female genital tract. These probiotic effects ultimately result in a positive effect on fertility. Bifidobacterium in combination with lactobacillus strains showed a specific impact on embryo transfer success rates also. So to conclude, the human vaginal microbiota plays an important role in the maintenance of women's health as well as her partner and her newborn. Probiotics and prebiotics products are increasingly popular due to the potential health benefits also in pregnancy. Based on the available evidences, probiotics may be considered as alternative means or can be used in conjunction with antibiotics for treatment as well as in preventing recurrences of vaginal infections, thus improving urogenital health and reproductive outcomes in women. Thank you very much for patient hearing.
So much, ma'am, for giving all the detailed information regarding bacterial vaginosis and how prebiotic and probiotics are helpful. So let me check for the questions. So, ma'am, the first question is, do you recommend probiotics in pregnant women? Are they safe to use?
Yes, they can be given. I do give,
Okay.
along with the vaginal pessaries for the specific treatment, and then
Yes.
always give probiotics.
And ma'am, does the probiotics works in pruritus?
Pruritus, actually you have to see what type of infection is there. Vaginal swab is done,
Yeah.
check blood sugar of the patient, and then decide. If the sugar is high, then treat accordingly. And pruritus can be given, antihistaminics can also be given with vaginal inserts.
And ma'am,
Those are really effective.
how much important is the specific strains? Like the strains should be
Yes.
genetically
Beneficial bacteria, that is Lactobacillus, Bifidobacterium, cristatus, Jensenii, gazeri, all these are used. These are bacteria. And the gram negative that usually infects are the E. coli, Gardnerella, Mycoplasma. Vaginal specific strains, native strains should be used in probiotics to help.
And ma'am, how long do you recommend this probiotics in any patient who come with these infections?
I usually prescribe them once BD for 15 days minimum.
And it can extend up to?
It can be given up to 1 month.
And ma'am, one more question is there, are there any kind of side effects, serious side effects while using probiotics?
Not really. I haven't
Never. So mean they
encountered
are
any
totally
harm.
safe.
Yeah, they
Totally
are safe. can be given with antibiotics. We should judicially use antibiotics.
Antibiotics. So,
First
ma'am,
treat with probiotics and then give antibiotics also.
so, ma'am, do you receive any antibiotic resistant cases? So, do you also restart the probiotics on these patients?
Actually, we do get resistant cases, relapse cases, recurrent
Mm-hmm.
cases.
Mm-hmm.
So what we have to do is usually take a syndromic approach of treatment for vaginal infection. See the character of the discharge, itching, urinary symptoms, partner treatment is also partner history
Yes.
is also important. Check sugar levels and do high vaginal swab. And if the vaginitis is present, either whether it's a bacterial vaginosis, treat accordingly. If it is candidal infection, treat. And if protozoa is seen, then treat
Yeah.
accordingly. Give specific treatment. And if the patient is still not responding, and I usually treat all three together. I give metronidazole, probiotics, and fluconazole.
Okay, ma'am. And one more question is that, ma'am, in which age group bacterial vaginosis is higher?
It is mostly in the reproductive age group, sexually active women.
So, do you receive any cases with infection in adolescent ages nowadays?
Yes, we do get it. We do get it. Patients, yes, poor hygiene and all that, we do get it in adolescent patients.
So,
We have to treat. We check sugar levels, we do vaginal swab and treat accordingly. And give probiotics. First, I give probiotics.
Okay. So, is there any impact of lifestyle modification also in such cases?
Yes, you can always tell the adolescent personal hygiene is important for them. We counsel them regarding personal hygiene. Perineal washes can be given in adjunct with this antibiotic short course therapy with probiotics. Regular exercise. All these do help.
Plus, lifestyle modification is also needed.
Yes.
So, thank you so much, ma'am, for giving all these answers to these questions. And we are glad to have you on our platform on today's webinar, and might have more sessions with you, ma'am, in future on another topic. Thank you, ma'am.
Thank you for inviting me as a speaker. Thank you so much.
Yes, ma'am.
Nishant, thank you. Ma'am, I have one doubt, Bharat from Shield side. Can I ask you, ma'am?
Yes, please.
Okay, ma'am, nowadays, a lot of probiotic specific strains have entered in the market.
Yes.
Because probiotic market is a huge market. And do you believe that specific strains?
Yes.
And when it comes to our product like Totalis, we have got 7 specific strains.
Yes.
What is your comment, ma'am, opinion on it?
No, it is a good. I am using this product. It's really good results.
Okay. So
our patients are benefited with it.
Yeah, especially when it comes to specific strains, will they work, ma'am?
Yes, they are. Nowadays, it is a trend that vaginal specific strains to be used.
Okay. Thank you, ma'am. Thank you.
Thank you.
Yeah, Nishant and Yogesh and Mr. Ganesh, thank you so much. And ma'am, once again, thank you for accepting our invitation and to be a speaker on our Shield digital platform. Thank you so much and have a nice evening, ma'am.
Thank you.
I'm happy Ramadan.
Thank you.